So, back on the BPG podcast with Michaela today to talk about a new session that we will be offering that we were actually a little bit resistant to at first, which we can talk about why a little bit later. But what is this new session that that you specifically will be offering?
Yeah, so now we're going to be doing dry needling or cupping only sessions. So you're just going to come in and we're going to cup or dry needle, and that is it for the day. And initially, I was resistant on that just because with those two modalities, exercise is so important. So with dry needling and with cupping, we're making physiologic changes. And there's two podcasts out there, one that we have on dry needling and another on cupping that's coming that goes into more of the science of those. But basically, we're making those physiologic changes, and for the best results, we need to follow that with exercise.
Okay.
So initially, I was resistant to offer those services just because I want to give the full, service and the full package and the full potential.
Right.
But now I think we have a good setup and a good client base, and I think everyone's kind of ready that now that we have the tools in place, we can start offering this. So it is different than our typical regular sessions. Typically, those are an hour long, and then we do everything. We'll do some hands-on work. We'll do modalities. We'll do exercises. We'll do education and set you up with your home exercise program.
In the hour-long
one. And then we have in the past offered recovery sessions, which is after base day. And those are like 15 minutes, soft tissue work and cupping. This one is 30 minutes. It's $60 for the 30 minutes. You're going to come in and we're going to apply the cups or drop the needles in, and then you're going to leave. And the intent with that is that you are then going to go home and do your exercises to follow up with those services.
Okay. So let's say they book the 30 minutes with you, and then they go home and do their exercises at home. Will they come back for another dry needling or cupping session? Is it a standalone session or?
So it's a standalone, but it'll fit really well into like a outstanding clients and like existing plans of care.
Gotcha.
So people that I see every couple weeks, or maybe, we're doing once a month, for them, they might just want a little session here or there to just get some refresher from the needling. So, we can do it one time. We can do it as many times as they want.
Okay. So can anyone book the 30-minute session?
So right now, as long as someone has come and seen me in the past for that same issue, so they have an existing initial evaluation in place, they can book it.
Okay.
But we have to have that evaluation so that way we know what to treat.
Right. You don't want to just like stick needles in them just to do it.
We're not guessing. We're testing and then treating.
Yes. So who would benefit the most from this type of session, these 30-minute ones?
Yeah. So like I said, the existing clients that we maybe have their treatment plan spread out and they need a refresher, or the ones that we've had on caseload and then either they've discharged or we're taking a break and seeing how they do, and they've had a flare-up of symptoms that they would really benefit from coming in. And then also just anyone that's maybe recovering from training or doing an event or something like that, and they're just like wanting to help reduce soreness and just speed up their recovery, they would really benefit from that too.
So like someone, for example, you just did a high rocks event. So someone that's wanting to recover better from that or prepare for that.
Absolutely.
As long as they've seen you once before, or at least done the initial eval.
Yeah.
Cool. So I'm the type of person that I like to check out the parking situation before I go anywhere. I like to kind of know what to expect. So what can clients expect out of these 30-minute dry needling or cupping sessions?
Okay. So when they come in, we're going to have a quick catch up and like symptom review. So what's going on, what's changed, what do you need? Like just trying to get a playbook for what we're going to do. And then I'm going to do just a quick assessment. So just seeing what we're dealing with.
Yeah.
Hands-on, do some range of motion, do some muscle testing, that kind of stuff. It's just going to be a few minutes, though, nothing like an evaluation. And then we will do the needles or the cupping, whichever, some people have a preference, but it could also be based on what they need
The
or
need
what
of
they
the
would
client.
would benefit from the most.
The most, yeah.
Or sometimes people might get both.
I was about to ask that. Can you do both in a
You
session?
you can do both in the session, and they work together and on different things. But it's a little harder in that short period of time to do both. So for most people, it'll be an either or.
Gotcha.
And then once we do those, we'll finish up with just a few exercises just to make sure that we're clearing the blood flow and all of that into the area. But it'll just be stuff in the room. And then the intent is, like I said, to go back and do your home exercises.
Yeah, because the exercises you said are super important in conjunction
Absolutely.
with the two. Cool. So if I were interested in booking one of these 30-minute sessions, how exactly would I do that?
So you do it in the app, just like most of our services. You just go to the app, and then you would click on the Buy tab, and then physical therapy, and then it's the cupping and dry needling, and it'll be like cupping, dry needling, $60. And you just click there, book it, and then I'll get a notification, and I'll reach out to you to get it scheduled.
Get it scheduled. Oh, super easy peasy.
Absolutely.
I love it. I love it. So yeah, it's a new session that Michaela will be offering. Again, like Michaela said, just go to the app to get that session booked. And if you are interested in learning more about the science of dry needling and cupping and how and why it's beneficial, we already have a podcast out on which one?
Dry needling.
Dry needling. And so the cupping one will be coming soon.
Yes.
So you can check those out to learn a little bit more in depth about those specific treatment options.
Yeah.
Thanks, Michaela.
Thank you.